So the final step, step 5, in steps that are involved when a microbe causes disease in a host would be exiting the host. So as I said earlier, portals of exit like respiratory, salivary glands, skin cells, fecal matter, urogenital tract, blood, these are all similar to the portal of entry. So wherever, if it's a respiratory portal of entry, then it's a respiratory portal of exit, and so on. So we're going to talk about a few of those different portals of exit. So here you can see some examples: coughing, wheezing. So like if you breathed it in, you probably cough or sneeze it out. If you got it through an insect bite, then insect bite is how it's transmitted. Removal of blood, feces, urine, any of those skin cells, they can all transmit the disease. So respiratory portals, the mucus, sputum, nasal drainage, other moist secretions. Skin scales, the outer layer and scalp are constantly being shed, and you get household dust composed of lots of skin cells, and we shed about several billion skin cells a day, which is pretty crazy. Think about it. Fecal exit, so through the feces, that's pretty obvious, but diarrhea will provide a really rapid exit. Helminth worms release their eggs and cysts through feces, and feces are basically a contaminant in drinking water or when they're used to fertilize crops. So if the feces had an infection in it and it's used to fertilize crops, then if it didn't get cleaned off, that would be a way of transmitting it. Urogenital tract, the sexually transmitted infections as well. So that's how you got it. That's how you're going to give it to someone else. Removal of blood or bleeding. So ticks or fleas may suck your blood, and that could be a way, or just through a needle puncture, some sort of transfer. And so then long-term effects, long-term infections and long-term effects. So latency is a dormant phase. So you're not experiencing symptoms. It's not rapidly, it's not multiplying at that point. And during this time, you will not have symptoms, and a microbe can be periodically active and produce a recurrent disease. So this is what I was saying. So there's a little bit of a difference between chronic and latent. Chronic, you're dealing with the symptoms for the rest of your life. Latency is when you have recurrent infections. So syphilis has that, different stages of syphilis throughout your life. You'll have issues. Tuberculosis can flare up. Malaria can enter into different stages. You can be latent and then have a recurrent infection. Herpes, though, to me is probably the best example of a latent infection, because it's going to be in your nerve ganglia and periodically will produce an active infection. So sequelae are the permanent damage to organs that happens. Meningitis can result in deafness. Strep throat can lead to rheumatoid heart disease, rheumatic heart disease with the scarlet fever. Lyme disease can cause arthritis. Polio can cause paralysis. So that is not something that goes away. So if you've seen some of the meningitis B commercials lately, they're pretty like in your face about some of the sequelae. So they're showing kids that had hepatitis B and they lost limbs, or they were deaf, or some other kinds of things that resulted from having hepatitis B, just to kind of point out that even if you do survive, you could have long-term symptoms for this if you don't get the vaccine. So course of infection, there are 5 stages, or 4 stages, I guess, of this clinical infection, the classical stages of infection. And what's interesting is this is similar to the stages of the population growth curve. So when you have a low number of microbes, you have a low number of symptoms. So like incubation, right after you're exposed, you have very low numbers and you have very low number of symptoms, probably no symptoms. So this is talking about not the number of microbes, but the number of microbes correlates to the amount of and type of infections or symptoms. So with incubation, a lot of times you don't have any symptoms. So there's a period, and that can be variable. Different organisms will have different incubation period. And then the prodromal, that's probably a new term for you, I would say. So you want to make sure you know these stages. Prodromal is when you have the earliest notable symptoms. They're probably very non-specific. And then the acute phase is when they are at the highest levels, the infectious agents at the highest levels, and you have the greatest virulence, and you have very specific symptoms and the highest amount of symptoms at this time. So you have high numbers of microbes, high amounts of, large amounts of symptoms. Convalescent would be when you're declining, the symptoms are declining, and that's because the infection is declining. So the amount of infection and the amount of symptoms are usually correlated. So you can see here, incubation is like during our lag period, and then log is like early stages would be prodromal, and then acute, and that's kind of at the height of the infection, and then you have the convalescing period. And so really there's like a fifth stage, which is the continuation phase or period if you have a chronic infection. But the convalescing period generally decreases the symptoms as the amount of microbes decreases, and that's like the death phase of the population growth curve. So it's like lag, log, stationary, death, and that would be kind of the reason why it's important to think about this, and the population growth curve correlates. So here's our concept check questions for section 13.2, and I will go over the questions, and you might want to pause, try to answer it yourself, and then see if you got it right. So first question, true or false, if a virus causing a respiratory disease is ingested, it will not cause disease. So I love these true or false questions because some of these are not always cut and dry true or false. Typically, a respiratory disease is going to be not ingested. It's going to be, you're going to breathe it in. So it could, but probably not. So it's usually breathed in, not ingested. So a minimum number of microbes required to cause a disease is called the blank blank. So that is the infectious dose. So that's question 2. Question 3, bacterial blank are toxic to the host in minute amounts. So this is either exo or endotoxin. I'll give you some choices here. So it is an exotoxin because exotoxins are secreted, and small amounts of them, because they're enzymes a lot of times, can be used over and over again. So question 4, a blank is an objective evidence of disease. So that would be a sign. So it's something that we can observe. So objective is observable. So signs can be measured or observed. It's objective. So question 5, during the period of blank, a pathogen exhibits the greatest virulence. So the greatest virulence would be the acute stage. So that's when it's having the most symptoms associated with it. And that is the end of section 2.